My name is Bev Smith, and I'm the Executive Director of Kidsports, and I just want to thank you for being a part of the Kidsports team. We look to use all of the incredible community resources that we have in Eugene and Springfield, and one of those is Slocum Orthopedics. We have them as a resource to help you navigate some of those injuries and some of those bumps in the roads that are bound to happen when you play any kind of sport or activity.
We see over 275,000 patient visits a year, and many of those visits are related to injuries that are preventable. Kidsports and Slocum working together is just a great partnership for Slocum to get the word out on how to avoid injuries when you're playing sports.
Finger dislocations and jams are pretty common sports injuries in kids, especially kids involved in ball type of sports or contact sports. What happens is the end of your finger gets hit and it buckles at the joint. And really it just needs mobilization for a few weeks. We put children in a buddy strap, so we buddy strap it to the neighbor finger and we get you moving right away. You want to avoid any contact for about 3 weeks, but the recovery is overall pretty quick. Any child that's jammed their finger and it's very swollen, they have limited mobility, and you're seeing any bruising, should contact us immediately so that we can get some x-rays and understand what the fracture may look like or what the injury truly is. Fractures are very different, and that might mean casting, and that's more of a 6 to 8 week recovery period.
Ligaments in knees is the soft tissue support of the joint. One of the most important things as a parent or somebody that's been injured is to think about, I got injured, what does my knee feel like? What does it look like? Am I swelling? Rapid swelling after a knee injury is a very important sign that your knee needs to be looked at right away. I think as a parent, if your child injures their knee, I would have them take a break from whatever they're doing. So I wouldn't have them go back in and play sports immediately and watch them. When a child starts walking normally, when they're worried about something else, that's a good sign their knee's going to be okay. When they cannot be distracted, when they are focused solely on their knee and several hours have passed and they are still talking about their knee, that's a worrisome sign. When you first have a knee injury, there's some very helpful things to consider. One is the acronym RICE, which you may be familiar with. Rest, so you're gonna stop whatever you're doing at that moment. Ice, some cold compress on there to help with swelling. Compression, so you maybe will wrap the knee with an ACE wrap. And elevation, getting that knee above the level of your chest to help with the swelling. One of the best things you can do to prevent a knee ligament injury is year-round conditioning. A cross-trained, physically conditioned athlete is the least vulnerable person, so you want to be that person.
The good news is the vast majority of ankle sprains get better just with time. When somebody sprains their ankle, the most common way it's sprained is with an inversion type injury where the foot rotates, in relative to the rest of the leg. Common symptoms after that would be pain along the outside of the ankle, swelling at the outside of the ankle, bruising most commonly on the outside of the ankle. Initially it wouldn't be uncommon for, an athlete to have trouble putting weight on the ankle. If an injury is severe enough to where you're not able to put weight on it after 2 or 3 days, then it warrants an x-ray. Return to sport after an ankle sprain or really any injury is just having near normal strength when compared to the other side. So I think one of the things that we're trying to prevent with getting somebody back to sport is to prevent another injury if they're still recovering from their previous injury and aren't quite ready to go back.
So what makes us worry about whether someone's had a concussion? Well, almost always it's going to be predicated by a blow to the head or the body. And typically those symptoms are going to come right at the time of injury. And those symptoms are very often going to include headache, nauseousness, dizziness. Sometimes we'll see vomiting and just a generalized confusion. If you're suspicious that your child has had a concussion, you don't have to take them straight away to the emergency room, okay? There's nothing wrong with just making them comfortable. The number one thing we want is to remove from activity. Now, if they seem to have increasing confusion, increasing headache, if they have more than one episode of vomiting, those are the triggers that I would say, then you want to go to the emergency room to be further evaluated. Otherwise, if symptoms seem to be not severe, totally fine to let them sleep. You do not have to wake them up every 2 or 3 hours. It's okay to use some Tylenol or some ibuprofen if they're having headaches. And then I would definitely recommend calling your family medicine doctor or your pediatrician and getting them in to be seen within a day or 2. When it comes to returning to sport after concussion or a suspected concussion, there's kind of the one big thing from a sports standpoint is that there is a state law. Every kid who's had a suspected concussion or a definite concussion needs to be evaluated, and then we return them back to play on what we call a return to play protocol. So it's not just signing off and saying, hey, your concussion's better, you can go out and do a full practice tomorrow. It's a stepwise increase in activity over a 5-day period. If it's a kid who's younger than high school age, the healthcare provider and the coaches are going to have to make sure that they return through those steps of the protocol before they're able to fully get back playing.
Thank you for taking part in this video series. We hope it's been very helpful, and I think it reflects how much we care about your child's experience here in our youth sport programs and how much we will use community resources like Slocum to provide your child with a wonderful, warm, safe, and exciting season of sport. Thank you.